and welcome to A Sound Constitution here on CHLY 101.7 FM, a show where we focus on health topics important to our community. This year's team is made up of 8 third-year VIU nursing students, and our goal is to demystify health issues and address common misconceptions by sharing evidence-informed information from a variety of reliable resources. All information provided on our show will be available in our show notes on Facebook and Instagram pages. We want to remind our listeners that the information presented in the show is for educational purposes only and does not replace the advice of your primary healthcare professional. If you have any questions or concerns about what's being discussed, feel free to reach out to us on Facebook at A Sound Constitution, Instagram at CHLY A Sound Constitution, Twitter at ASC_VIU, or email us at asoundconstitution@gmail.com.
We would like to start our show by acknowledging that we are on the unceded territory of the Nanaimo people, with a broadcasting range that overlaps the Coquitlam and Sliamon territories. This acknowledgement is done with the gratitude to the Nanaimo people and with the intention to increase awareness about truth and reconciliation processes and efforts on Vancouver Island. Additional information and resources surrounding the Nanaimo history, reconciliation, protocol, and land acknowledgement can be found on our Facebook, Instagram, and YouTube pages.
Have you ever wondered why the wait in the emergency department is so long? Or have you ever wondered what goes on in the emergency department? Well, then you have tuned into the perfect episode. Welcome to an episode on emergency and urgent care services. Hi everyone, thanks for tuning in. In today's episode, we will be discussing emergency and urgent care services. Your first question might be, what even is the difference between these two services? Well, I'm here to give you a brief little definition, as throughout the episode we will be discussing both services in detail, focusing primarily on emergency care. So, to begin, urgent primary care are for illnesses or injuries that are not life-threatening. So, for example, a sprain. An example of urgent care is a walk-in clinic. Emergency care, on the other hand, are for issues that may be considered a medical emergency, for example, a heart attack. An example of emergency care would be the emergency room at a hospital. So now that you kind of know a little bit about the difference between these two services, let's discuss what topics will we talk about in this episode. Ever wonder why the line is so long in emergency or why the waiting time is so long? In this episode, we sit down with a wonderful registered nurse who has lots of experience in the emergency department. She gives us some keen insight into the emergency room and what her role looks like. At the end of this episode, my co-host and I participate in a short little quiz and share some emergency and urgent care resources in Nanaimo. Now I'm going to pass the mic over to my lovely co-host Karis. She is going to tell you a little bit about what you might expect when going to the emergency department. Stay tuned and hope you enjoy the episode.
Visiting the emergency department. A question you might ask yourself is, when should I go? If you or someone in your care is experiencing a health crisis or has an urgent medical condition, do not hesitate to come to the nearest emergency department or call 911. On arrival at the emergency department, you will be assessed by a triage nurse and seen by a physician on a priority basis. Examples of an urgent medical condition include but are not limited to signs of a heart attack or stroke, extreme pain, severe bleeding, broken bones, shortness of breath, or respiratory distress. If you aren't sure if you have an urgent medical condition, you may wish to call HealthLink BC at 811 to talk to a registered nurse and determine whether you should go to the nearest emergency department for treatment. How long will you wait? Well, that's a tricky question to answer. A triage system is used. That gives priority based on the emergency and urgent care you require. This can result in delays if you do not need urgent care. Triage nurses will try to give you an estimated time, but even wait times can change at a moment's notice. While emergencies are unavoidable, here are a few simple things you can do to avoid unnecessary visits to the hospital. For non-urgent care, contact your family physician. Call HealthLink BC at 811 for confidential health information and non-emergency services. Familiarize yourself with the locations and hours of walk-in clinics in your area. Search online for those walk-in clinics. This information for this fun fact can be found on the Island Health website under Visiting the Emergency Department and in this episode's show notes. Now let's get back to the episode.
And so now I'm going to explain a little bit about the triaging system that Karis talked about earlier. The Canadian Triage and Acuity Scale, CTAS, is the most predominantly accepted method for grouping patients according to the severity of their condition upon arrival to the emergency department. So now I'm going to briefly summarize the different levels of the Canadian Triage and Acuity Scale. CTAS, which stands for the Canadian Triage and Acuity Scale, has 5 levels. The levels rank in order of priority from 1 to 5, with level 1 needing immediate medical attention and level 5 requiring non-urgent care. So let's go through the different levels. At the top we have CTAS 1. This means the patient is severely ill and requires resuscitation. These are conditions that are threats to life or imminent risk of deterioration. This patient requires immediate medical interventions. An example could be cardiac arrest, major trauma, or shock states. The next level is CTAS 2. This means the patient requires emergent care and rapid medical intervention as the condition is a threat to life or limb condition. An example could be a head injury or internal bleeding. Next we have CTAS 3. This means the patient requires urgent care as the condition could potentially progress to a serious problem requiring emergency interventions. An example could include moderate asthma. Next we have CTAS 4. This means the patient requires less urgent care. Some examples include urinary symptoms and mild abdominal pain or an earache. Lastly, we have CTAS 5. This means they require non-urgent care in which investigations are delayed. An example could be a sore throat, diarrhea, or minor lacerations, not requiring closure by any means. These levels reflect how quickly you will be admitted into the emergency department and be assessed by a physician. This is just a brief overview of triaging in the emergency department, as the nurse that we interview will go into more detail on the different levels. Hope you were able to learn a little bit more about triaging. We are now going to move on to our interview segment of this episode. Hi everyone, it's Kiana, and in this segment, I'm interviewing a registered nurse who works in an emergency care department. In this interview, we discuss the different roles of the nurses in the ER as well as other healthcare professionals like doctors and social workers. We also discuss the admission process, triaging, and discharge teaching. Tune in to learn more about the services that are offered in the emergency department as well as urgent care services that are in the community. Hello, Ruby. Thank you so much for sitting down with the Sound Constitution today. We are so happy to have you on the show and would love to learn more about your role as a registered nurse working in the emergency. So I have some questions for you, but first, I think it would be great for our listeners to learn more about your background in nursing. So what made you go into nursing?
Thanks, Kiana, for inviting me to this, to your radio show. This is a great opportunity to share my passions in nursing and just highlight the importance of emergency nursing. What made me go into nursing and specifically emerge? I think as an individual, I have always been attracted to helping and providing care to individuals around me, the community. Why in particular emergency? Well, emergency has a lot of variety. There's a lot of different presentations, populations. You are able to care for people from the geriatric population all the way to pediatrics. There's a variety of cases that you are presented with, such as musculoskeletal injuries to full-on trauma. So the variety of learning experiences is varied, but more importantly, knowledge and education that nurses have come to full presentation, because in emergency is the time when we look after clients who are at their most vulnerable, and it allows nurses to support them and guide them to become better physically, mentally, provide not just medical treatment, but also support them psychologically, as well as support their families. So there's a lot of very exciting aspects of emergency. There's a lot of critical thinking involved. It's fast-paced, investigation to determine what is happening, and managing what is in front of you in terms of emergency is very exciting. You see the results pretty quickly. Do you know what I mean? Like, you're able to provide some treatment and see the impact quickly, and really the journey, supporting the journey of a client through these hard times, and making a difference and making a positive impact is very satisfying. Obviously, as you know, nursing is predominantly women, so to have a role in the community where women is represented at a high esteem is very important to me. I'm a very strong believer in the contribution and the strength of women, whatever it may be, and nursing happens to represent that. And one more thing, which is an important aspect of emergency, is the autonomy. Especially where I work, there's a lot of protocols that have been created by nurses to provide autonomous care for the clients in the community that we provide. So there's a lot of independence. There's a lot of collaboration. We are part of a team, but nursing, a female-dominated profession, is highlighted in that we can create an impact by independently thinking and acting for the best interests of the community and the patients. Yeah, that's why emergency is the place for me, and nursing is fantastic in that sense.
I can tell you're really passionate about that, so thank you so much for sharing that. We want to learn more about what is the process, I guess what the process looks like for a patient who is admitted into the emergency department up until discharge. So I guess starting from their admission point.
So let's say you come in with a broken foot. Right. The first part of the emergency journey is that you get triaged. So as triaging is a process for sorting out. So basically, when a patient arrives, we determine whether there is a concern in terms of their life, or there's a concern for a debilitating injury. So like a loss of a limb or something like that. So the triage nurses who have special training. So let me actually go back. To become an emergency nurse, you need to complete an emergency specialty. Once you become a triage nurse, you have additional education. Usually the triage nurses have additional, on top of additional training, you have years of experience that allows you to make decisions in a very short period of time, within seconds. Usually at the front, we decide, as a triage nurse, you decide whether this person has any ailments that may cause death, or something that may debilitate them and result in a prolonged pain or injury. So that's triaging. That's the beginning portion of when a patient comes. So a patient comes in with a broken foot. We assess them based on, it's called primary assessment. So looking at their airway, breathing, circulation, and their neurological status. After we ensure that process, there's no imminent injury, we proceed on to the focus assessment, which is the injury that they're in here with. So we assess their foot. If there's anything that may be debilitating, they are seen sooner. So it's based on a triaging system, is based on the speed of when they need to be seen by a physician and a nurse.
Are there different levels?
Yes. So triaging levels range from 1 to 5. 1 being there is risk of death. So those people are seen right away. Somebody who is triaged as a CTAS, which is a Canadian triaging system, CTAS 5 is somebody who may be asking for a prescription. Okay, so somebody that can wait a little bit longer. Somebody who's CTAS 1 means that they need to be moved to the more acute area, like the trauma room, and they need to be seen pretty quickly. So once the triage nurse decides what triage number the patient is, they are sorted, or they're sent to an area where they will receive the proper treatment and the resources in terms of staff experience, staff resources, the equipment, medication, that kind of stuff. Once they're triaged, the person with the injured foot is sent to where they're supposed to go. There they are. This is where the nursing autonomy comes, where the nurses will initiate either blood work or X-rays without a doctor's order. There's predetermined education to be able to have that autonomy. So, and this decision making, comes with critical thinking on top of the education, right? So the decision for the diagnostic tests and blood work, we also can initiate analgesics, so oral analgesic, Tylenol, Advil. Once they go to that area, they start to get their blood work. Then the physician eventually sees them. The physician deems whether they need additional specialties that requires them to stay in the hospital, or whether the treatment that they require can be done in the community. So when a patient requires additional treatment that cannot be done in the community, it needs to be either done urgently, or the patient needs surgery immediately. That's when they get admitted. So the patients are admitted when the resources in the community are not available, or there's a time sensitivity, or the patient's too sick and may get sicker if they're discharged home. So they need to stay in the hospital. That's how the decision for admission happens.
Oh, okay.
Yeah, because there's a lot of resources out in the community. For example, if this individual with a broken foot needs surgery, well, because there is some neurovascular compromise, like their foot is blue, that means that they need to be seen pretty quickly. They cannot wait for a day or two. They cannot just have a cast on. They need to have surgery that day. That person's going to get admitted. If, for example, they have an infection for whatever reason, we have community services that can do antibiotics. But if this person cannot manage to go to those services in the community, that person will have to stay in the hospital, because that service needs to be provided for that patient. Does that make sense?
Yes.
Mm-hmm. Yeah. So that's how the admission happens. And then did you want me to talk about how they get discharged?
Yes, a bit about that. You can either talk about that now or later.
So the patients stay in the hospital, usually in the hospital in emergency. until a bed is available on the floor. So somebody with a broken foot should go in orthopedic unit. If the orthopedic unit is full, they stay in emergency until such time that there is a bed up on the floor.
And I guess the assessments you do during like their stay in the emergency department, I guess that all varies, but I was wondering if you could maybe talk about the assessments and I guess the patient teaching that you do while they're in the emergency.
So it varies. No, I will go back. Assessment in emergency is very much focused on primary, secondary, history, and focused assessment. So primary assessment is focused on your ABC, otherwise known as neurological status or pain. So that's primary. Any issues with the primary assessment means that it needs to be managed at the moment of discovery. So if the patient is short of breath, that needs to be dealt with before moving on to the other assessments. After primary assessment is completed, secondary assessment is done, which includes history, allergies, reason for why they came to the hospital, and then assessment on the final aspect of assessment is focused, which is specifically their concern. So if that gentleman came in with a broken foot, focus will be on the musculoskeletal neurovascular, which is the leg. So that's focused assessment, and that is ongoing while the individual is in the hospital.
And I guess it depends the teaching you do because there's so many different cases that you deal with. Are there any like main teachings that you do though?
It depends what the patient's in here with. If the patient is a newly diagnosed diabetic, then we are fortunate to get or have access to other professionals who are proficient with that education. Nurses can start providing discussion, diabetic teaching, but we can also access pharmacists and the diabetic clinician. If they come in with pneumonia because of a fractured rib, we do teaching on deep breathing, coughing, that kind of thing, mobility, just the basic nursing foundations that we're all taught in school.
Hi everyone, we're just going to take a quick break with a fact break from McKenna.
Did you know that the Nanaimo General Regional Hospital is the busiest emergency department on Vancouver Island? To avoid unnecessary visits to the ER, there are some things you can do. For example, for non-urgent care, you can contact your family doctor. And if you're uncertain, you can always call 811 to speak to a nurse about what your condition needs. There's also resources where you can search for online clinics. Getting a flu shot and washing your hands are also important to avoid spreading and contracting viruses and bacteria. And there are also safety precautions such as buckling up when you drive and not leaving open flames unattended. Stay tuned for more information on the emergency department as well as walk-ins throughout this episode.
And now back to our interview with Ruby.
I'm guessing like working in the emergency department, you work with a bunch of healthcare professionals. I was wondering what is like the difference in your role as the nurse versus the doctor or other healthcare professionals that you interact with?
That is a fantastic question. You're correct. So we are fortunate enough in the acute care setting in emergency to work with multi-group allied health physicians, pharmacists. It's a wonderful team with their own specialty. Now, nurses, the difference between a nurse and the doctor is our focus. I mean, we both overlap the empirical aspect, the science-based disease process knowledge, but the nurses very much focus on the holistic aspect. And we focus not just on the illness, but we focus on the psychosocial, the emotional aspects, which is a strength of ours. Because a patient, an individual cannot just, any prescriptive instructions that is provided to patients will not occur if other structures are not in place. So let's say there is an elderly patient that comes in with pneumonia. If the individual has no means of support in the community, no money, how are they able to get the treatment, so their medication? How are they able to stay nourished if this is not provided? So what the nurse does is take all this into consideration and collaborate with those individuals who can support this patient.
Oh.
The physicians, in comparison, the physician focuses primarily on the disease process. Patient comes in with pneumonia, let's give them antibiotics. They may need puffers, that kind of stuff, and it stops there most of the time. It's very impressive what the contribution of nurses are in all aspects of healthcare, because there's a lot of need for not just focusing on the disease process, but really incorporating all aspects of the individual, because that's how they will get better. The creation of a caring relationship is vital, because in order for health and well-being to occur, you need to build that kind of relationship, and that's what nurses are good for. And of course, nurses have specialized knowledge and skills. So, for example, it's quite funny. So my role in emergency is as a resource nurse for the rest of the team. And so there are, I'm usually called for skills that the other staff need a review on. So one of the skills that nurses know are very proficient with is, for example, wound care. So there's a lot of knowledge that nurses hold that they can perform. It's a great teamwork, and it's a great dynamic.
It definitely sounds like that. And what are the different roles of the nurse, like different titles in the emergency department?
So it varies. Every emergency has different roles per se, but the main ones in emergency departments are usually the charge nurse. So they're the ones who coordinate and operationalize the flow of patients in the department. We have a triage nurse assigned in the patient assignments. We have educators, we have resource nurses, and we have med surg nurses as well, and LPNs, who all make up the emergency team.
Lots of collaboration,
and it's vital. One of the roles that nurses fill in emergency is that, in fact, nurses are the one who operationalize the unit. So the flow of where the patients go, the resource allocation in terms of beds, move up to the units, or transfer up to the units, organizing discharges, all the operational aspect is done by the nurses. Anyhow, I just wanted to highlight that.
Yes, thank you for highlighting that. I didn't really know much about what the different roles are, so thanks for sharing that.
In case you're just tuning in now, my name's Lauren and I'm here with my co-hosts McKenna, Kiana, and Karis, and you're listening to A Sound Constitution here on CHLY 101.7 FM. And today we're discussing emergency services and urgent care.
One of our questions was also, what is the difference between urgent care services and emergency department services? Because I'm not sure, this is just an assumption, but I feel like some people might not really know the difference.
So urgent care services, they do deal with urgent injuries that require imminent treatment, but they are less critical. Usually urgent care centers have a limited criteria for the type of patients that they can see, because they have limited hours, limited resources in terms of staffing, limited supplies. So they are able to look after patients who have a sprain, who might have a suture that need to be or laceration that need to be sutured, or maybe infection. There are some urgent care clinics that cannot do diagnostic stuff, no blood work, no x-rays, but that's changing. Whereas emergency departments can have resources to accommodate and look after a variety of different presentations, because the resources are available, the equipment, diagnostic, all that stuff. Does that help?
Yes, no, that clears it up. Another question is, what's a big difference between the emergency unit and other units in the hospital?
Emergency or emergency medicine deals with immediate life-threatening or debilitating cases, as I've mentioned before. So the difference is that usually the patients that arrive in emergency, we don't know what's happening with them. They have no diagnosis, versus units. Usually by the time the patient arrives at the unit, they have a working diagnosis. When a patient comes through the doors of emergency, which is 24/7, and there's no limit to the number of people coming in, we don't know what's going on. Patients that access emergency is, there's a thought that there is either an injury that is debilitating or there is risk of death. Yeah. So that's the main difference in with emergency and a unit. Also, emergency sees a vast, like the spectrum of the types of patients we see is from pediatrics all the way to gerontology, to the different types of specialty, whereas a unit usually has focused specialties. So there is the nephrology unit, there's a neurological neuro unit, whereas emergency is a mishmash of all the presentations and all the possible injuries.
That's a really great point. Thanks for sharing that.
I guess one kind of question is about, you mentioned before that you teach your patients a lot about the community resources that are available. So I guess just touching on discharge and how you help them get those resources in the community.
Discharge teaching will depend on what they will need, so, or what they come in with. So and also what equipment they're going home with. Discharge teaching is focused on prevention, safety, empowerment, but yeah. So preventative type of discharge instructions would be, for example, somebody with a fractured foot with a cast, giving them instructions on mobility to prevent DVTs, preventing infection, that kind of thing is provided. If the patient is going home with a Foley catheter, because that happens, sometimes we provide discharge instructions on how to look after that equipment. If they go home with medication, we give them instructions on how to take that medication, when, and what side effects to look for. And then instructions on follow-up, when to follow up, for example, with their family doctor or specialist. Instructions if they are given instructions to take antibiotics out in the community. In a clinic, they are provided the directions to that clinic and when to book an appointment. Yeah, those are the general overall instructions that we provide for discharge.
Is there anything you wish people knew about the emergency department, and what is your favorite thing about working there?
Emergency is so dynamic, and the team that I work with is just phenomenal, especially when there is critical incidences and very challenging emotionally, physically, mentally, when patients come in at their most vulnerable. Having a team that is very supportive, I'm always reassured that they have back. It's very helpful. Plus, you have this the opportunity to continue to learn, because there are always different cases, and there's such a variety to challenge your mind, to pull your to really pull your way of thinking and utilize everything that you've known to support somebody, to provide the best possible care. Is very rewarding. So that's kind of what makes me stay in emergency. It's that excitement, and the provision of excellence in that sense, especially as a nurse.
It definitely.
And I forgot what the other question was.
It was just like your favorite thing about working in the ER.
That's mostly my favorite thing. It's all of that.
Yeah.
Oh, you had mentioned that what is the one of the things that,
oh yes.
or what are some of the things that, yeah. Some very important aspect of emergency that many people don't know, and I didn't know about it until I started working in emergency, is that to get service, it is not first come, first serve. It is based on the C test that I mentioned. It's based on triaging. It's based on whether there is risk for death, debilitating injury. So it doesn't, service is not provided in a first come, first served way. There is a possibility that you may wait. With the news, it's been covered that people have waited for many years, and it's very unfortunate. But this is the reality, that sometimes may wait for a period of time, depending on the volume of patients coming in, that kind of stuff. Mm-hmm. The other thing that I really wanted to highlight is that the team in emergency department are comprised of many individuals. They're human beings. So doctors, nurses, social workers, they are people's aunts, moms, grandmas, sisters, brothers. And because, and I remind the humanity of the staff in these departments, because there is high incidence of violence in emergency. I know people are coming in at their most vulnerable, and frustrations do come out, but I just wanted to remind everyone that these individuals, these professionals who are trying their best to provide service to the community, are also human beings who have families and who may get hurt. So respect goes a long way and is reciprocal, obviously.
Mm-hmm.
Yep.
I think that was really important to touch on. That concludes all my questions for you. Thank you so much, Ruby, for sitting down with us today. We appreciate you taking the time again. And I'm sure I've learned a lot about emergency nursing from this interview, but I'm sure our listeners have also learned a lot. So thank you.
Fantastic. Thanks for having me.
Thanks everyone for tuning in and listening to our interview with Ruby, a registered nurse who works in the emergency department. We hope everyone was able to learn a little bit more about the emergency department and the services offered.
In case you are just tuning in now, you're listening to A Sound Constitution on CHLY 101.7 FM.
And now for a Sound Constitution mini game show with contestants Karis, Lauren, and McKenna. Tune in to see how they do. Hi everyone, I'm here with my co-hosts McKenna, Lauren, and Karis, and today we are going to do a little quiz on the difference between emergency care services and urgent care services and other online resources that you can use. So, I guess I'll just go through the quiz and ask everyone what they think the answer is. Feel free to share whatever answer you think it is. Okay, so the first question is, you recently injured your ankle at the gym and think you have sprained it. You are still able to walk on your injured leg. Which medical service would be your best option?
I think it'd be urgent care, because obviously if it's sprained, you may need like a boots. I don't know, actually, I've never sprained anything.
Yeah.
But, like, some sort of device that's going to make you not sprain it further. But I don't think it's worth going to the ER.
I agree.
I would say no ER unless you kind of think it's broken.
Yeah.
But because you're able to still walk on it and stuff like that, you can kind of monitor your symptoms and head into urgent care over the emergency.
Yes. You are all correct. You would go to urgent care, walk-in clinic. You also could call 811, which is the number if you want to talk to, like, an RN who you can speak about your symptoms and direct you, like, which service you should go to. So good job, guys.
Awesome.
Okay, next question.
All right, so our next question is that you are with your friend and you notice they're becoming very short of breath. They complain of chest pain and feelings of shortness of breath. What would your next step be?
I would say that shortness of breath is worth going to the emergency department.
I agree with that. We learn in nursing school about our ABCs, which is number 1A is airway, so I'd say ER.
I would agree with that. And same with the chest pain. Like, there might be something going on cardiac or something like that, so just to get it checked out would probably be the best.
You know what? I might even call 911 at that point if you're having chest pain, especially like if you're like someone starts becoming blue. I guess there's the things you kind of look for. Like if you can't breathe, like it doesn't look like they're getting oxygen. 911.
Yeah,
definitely.
That is the correct answer. You would call 911 and take them to the ER. Okay.
All right, next is you've recently been experiencing some pain in your ear. After using some over-the-counter medications for a few days, the pain has still not gone away. What do you think your next step should be?
I think for me, I would maybe get in contact with the 811 resource just to ask a couple questions and maybe have them direct me a little bit further as to where I should go.
I would either like to call my family doctor and maybe see if I can make an appointment.
I want to specify with this one because it's anything to do with infections. You kind of want to go to an actual walk-in clinic instead of like an online resource because you obviously need to be tested for the infection. Things need to be looked at. So, anyways, I would go to a walk-in or talk to my family doctor over going and using an online resource.
And that is correct. You would try to go and book an appointment or go see a walk-in clinic to get that checked.
All right, and the next question. For the past couple of days, you've been ill and one of your symptoms is a fever. You check your fever and it's 39.4. What medical service should you seek?
That's tricky.
That's a pretty high fever that's
high
been
fever.
lingering a while. Fevers are tricky because, like, you kind of, you know, they are doing a job, but also
If it's like
doing more
lingering
harm than
for a few
good.
days, that's
Yeah.
probably not good.
And quite high, like it would be hard on your body to be under that much.
Yeah, I'm not 100% sure, to be honest.
Yeah, this one here, the answer says emergency department. If an adult's fever rises above 39.4, they should seek emergency care. Also watch for other accompanying symptoms such as severe headache or rash. If the fever is below 39.4 but has not gone away after a few days, you can go to urgent care and primary care centers to seek some help.
Interesting.
The next question. You have been experiencing urinary tract infection symptoms. Which medical service would be your best option?
Probably, I would say family doctor or walk-in. Thing is that with that is like sometimes family doctors you can't get in right away.
Right.
So, and that's pretty uncomfortable to wait. So maybe walk-in.
Yeah, I was gonna say you probably call a like online service and then tell them about your symptoms and they probably get you a prescription pretty like quicker than going to like a family doctor.
Yeah, especially if you have a history of UTIs, like you pretty much know what you're experiencing, and then if you know what antibiotics that you've been on previously for them, it's a little bit less of a scary guessing game with antibiotics.
And you know pretty fast because those antibiotics work pretty quickly for UTI symptoms.
Yep, so the answer is you could either call a family doctor or go to a walk-in clinic, either online or in person.
All right. And you are at a party. You think your friend is showing signs of a suspected overdose. Signs and symptoms include breathing slowly / not breathing, cannot be woken / not responding, cold and clammy skin, pupils are very small. What would your next steps be?
I would say 911.
I would
I'd
agree
say
with that.
Maybe look for a naloxone or Narcan kit. Stay with them.
Mhm.
You won't get in trouble for staying with them.
You also won't get in trouble for giving Narcan or naloxone if you think that your friend or anyone is having an overdose. It's there's no really negative repercussions to giving someone Narcan/naloxone, so it's better just to do it if you suspect that someone is overdosing.
Mhm.
Anyways, the answer that we have here is call 911, give CPR/mouth-to-mouth until help arrives, administer naloxone, and so this person needs to be taken to the emergency department, which is true.
Mhm.
All right, next is you accidentally cut yourself when you're chopping up some vegetables for dinner. The cut is a minor cut, and you determined that you don't need stitches. What medical services could you seek out?
I think if it's a minor cut and you're thinking you don't need stitches, I think it's a good idea to still get it checked out. So maybe going to a walk-in clinic or using the resource of 811 just to see what they say. I think it's kind of a good buffer just to see where you're supposed to go if you're unsure.
I agree. I'd say walk-in clinic.
Yeah, and maybe 811 can even give you a little bit of guidance on like how to clean it or something.
Yeah.
Mhm.
What to do, yeah. Okay, yeah. The answer is to call 811 or go to a walk-in clinic and get that checked out.
Perfect. Next question we have, you're injured your back and you've been experiencing pain for a few days. The pain is worsening. What medical service would be your best option?
I'd say your family doctor. Like, I think with like back pain, like it's something that like kind of comes and goes, but that can become like a chronic issue. And I think with chronic, long-term systemic issues, it's better to go see someone that you're constantly seeing. So like not constantly, but someone that you see regularly, such as your family doctor.
Yes.
Right. I would even maybe go see like physio or something too for musculoskeletal.
Yeah. Good idea.
I agree. Your first option could be to call your family doctor. If not, urgent primary care centers such as the walk-in clinics treat new or worsening pain.
That is not chest pain.
That is
It's
not chest pain.
Make sure it's not chest pain.
Chest pain.
All right. And our final question.
Okay.
Your grandpa is showing signs of having a stroke. He has weakness in his left arm, is slurring his speech, and when asked to smile, his smile appears droopy. Which medical service should he be taken to?
I would say that's a call 911 and get to
He needs to go to
emergency.
emergency.
It's actually a good thing for anyone to know is the signs and symptoms of a stroke, and I believe the acronym is FAST. So that's facial, face, asymmetry,
Arms, if they're like weakness in one arm, they can't lift it.
yeah,
Face, arm, speech, if they're
Speech,
slurring or
slurring.
their smile is like drooping, and then time.
T is for time.
Yeah.
I think to call 911.
yeah. So anyways, the answer to that was call 911 or send your grandpa to the emergency department.
Well, that concludes a Sound Constitutions mini game show. Congratulations to our contestants. Okay, so that was the end of our quiz, and now we're just going to share some resources in the community for like these walk-in clinics that we spoke about. And we just wanted to add that all the information that was used to create this quiz was used from Island Health Resources, and we will include all of the websites and information in our show notes for this episode.
So one resource we've actually touched on a little bit is 811. So you literally just plug 811 into your phone and you'll be connected to an RN, and they'll help you determine the nearest emergency department for treatment, or if you should be going to a walk-in, or generally this is what their recommendation is. So basically you call 811 and you're connected to a health service navigator. They can provide you with health information, help you to navigate the healthcare system and find healthcare services across the province, or connect you with a RN, registered dietitian, qualified exercise professional, or pharmacist. There are navigators that are available any time of day or night, every day of the year. So this is different from 911, and I think that's an important thing to mention, because 911 is who you call when there's like a definitely emergency. And then there's actually another number you can call, which is the Community Outreach Response. The Community Outreach Response Team, CORM. So their number is 250-741-7645, and they provide community-based crisis response services to people of all ages experiencing urgent distress or immediate concerns related to mental health or substance use in Nanaimo. And again, their number is 250-741-7645, and that's the Community Outreach Team.
Another community resource that we were talking about is Telehealth. So Island Health has their own, as well as Telehealth themselves. So qualifications for this one, you need to be a resident in BC with a valid personal health number to qualify for the free service.
It's an online service, so you can go onto the website. It's 7 days a week from 8 a.m. to 9 p.m. You can consult with a doctor online. You do not need to wait in the walk-in clinic lineup, so that's kind of a perk for this resource. The types of services that are offered, there's general health checkups, prescription refills that get sent to the pharmacy or delivered to your door. They review your lab results, medical counseling, and check your symptoms as well. So that's a good resource to use as an online service.
Another online resource is called Rocket Doctor, and this is a virtual clinic, and it is also free if you have a valid BC health card. The online service hours to visit a fully licensed board-certified doctor, they provide care 24/7, so you can connect with a doctor virtually. They do primary care consults, e-prescriptions, lab referrals, medical notes, and you can get a prescription and then you can have it delivered right to your house, easy peasy, and that delivery is also free as well, and it takes like a day or two. And then another online resource is TiaHealth, and that's the same idea. It's virtual clinic appointments, and again, free with a valid healthcare card, and they offer walk-in appointments, online prescriptions, doctor's notes, and lab tests.
So another online resource that is free through certain insurance providers, but I'm not sure which ones, is Maple. And you just search in Maple and you can talk to a nurse practitioner or family doctor. You just write in your symptoms and what you're experiencing, and you'll have someone assigned to you. They also offer therapy. They offer dermatologists, but those are paid services. I'm not sure if they're completely covered, but it's a really great option for those who don't have accessibility to a walk-in clinic, or if the wait times are really long and stuff like that. So again, this is Maple.
And now I'm just going to share about the one walk-in clinic that we have in Nanaimo called the Medical Arts Urgent and Primary Care Center. So their hours, they are open 7 days a week, and they provide same-day treatment for non-emergency illnesses or injuries for when you are unable to see a family doctor. The service is offered basically if you have a sprain, cuts, a fever, ear and bladder infections, minor bleeding, or minor allergic reactions, anything that is non-emergent and can't wait more than 12 to 24 hours, you can go in to the clinic. Just some things that are not provided: they can't prescribe certain medications like narcotics or annual physical prenatal care or pap smears. And we will include all the information for this clinic in our show notes.
And so also I'll include the address. It is at Port Place Mall at 103-650 South Terminal Avenue. And one thing that's important to note about this, just I speak from personal experience, is that if you need to go to this walk-in clinic, it is, if you can get in there early and line up beforehand, I highly recommend it, because sometimes they do fill up. It's because we do have a physician shortage. So a lot of people are looking to use walk-in services, which is why, if you can, it's also might be faster to use one of the online services we've already discussed. Another cool platform that we have accessibility to is Medimap, and so this is just to help find a health clinic near you. And I mean, again, it is difficult to find a healthcare provider right now just due to the shortages, but Medimap does offer easy access to information on clinics near you, even the hours and services offered, and you can book appointments for certain clinics on Medimap.
This is Lauren with a fact break. Do you have a primary healthcare provider? If not, you're not alone. With the family doctor shortage in BC, many people are left without access to primary healthcare services. So what do you do when you need lab test results read or a prescription refill? While many people visit the ER, this is not ideal, as not only does it create quite a backlog in the emergency room services, but you'll also be waiting quite a long time. There are other options. Some of these options include visiting your local walk-in center, such as the Medical Arts Center, or using an online service such as Rocket Doctor, TiaHealth, or Telehealth. If you have a valid BC healthcare card, these services are free and can be accessed on your portable device. You'll have the option of either texting a doctor, using a video call, or having a phone call.
Well, That concludes our episode on emergency and urgent care services. We hope everyone was able to learn a little bit more about the emergency department and the different systems that are in place there. All of the information we discussed today will be included in our show notes that we post on our Facebook and Instagram, so be sure to check it out. Thank you for tuning in. I'm going to pass the mic to Karis now.
Well, that sound means you've reached the end of another episode of A Sound Constitution. Thank you everyone for tuning in today with your hosts, Lauren, McKenna, Karis, and Kiana. Be sure to connect with us on Facebook, Instagram, and YouTube. Join the conversation, access our show notes, and be in the know for our next episodes. As always, our friendly reminder to our listeners that the information presented in this show is for educational purposes only and does not replace the advice of your primary healthcare professional. If you have any questions or concerns about what's being discussed, feel free to reach out to us on Facebook at A Sound Constitution, Instagram at CHLY A Sound Constitution, all one word, or email us at asoundconstitution@gmail.com. Don't forget to join us next week for another episode. Until then,